That's fine.
All right.
Okay, we're all here. Well, some of us are here. We are officially recording. All right. Well, we will call to order the City of Edina Community Health Commission meeting. It is Monday, August 9th, 2021. And we'll just go around and do roll call.
Chair Sellies,
Here,
Commissioner Her,
she is no longer on the commission.
Commissioner Losich. Sorry if I'm butchering anyone's name. Loesch. Commissioner Wood,
Yes, here.
Commissioner Abelson.
Here.
Here, sorry. Commissioner Nelson,
Here.
Commissioner King Lowe,
Me here.
Commissioner Wright, Commissioner Hawkins,
Here.
Student Commissioner DeSimone, no. Student Commissioner Lee, Student Commissioner Mullen.
Yeah.
That concludes roll call.
All right. So, does everybody have a copy of the meeting agenda
Yes.
they can refer to? Okay. So let's review that before we can get an approval on the agenda for the day.
Move to approve.
Okay.
Second.
We have Tracy seconds. All in favor, say aye.
Aye.
Anybody opposed? All right, the agenda for today has been approved. And next we have the meeting notes from our last meeting. You scroll down in the agenda, they should be right there.
Move to approve.
Second.
We have a second. Everybody in favor, say aye.
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 Anybody opposed? Okay, the last meeting notes from July 12th have been approved. I'm guessing we don't have any community comments since there's nobody else in the room. All right. I will keep going by that then. Reports and recommendations. So smoke-free initiative, did you want to give your update next meeting?
Yeah, I think, well, we were gonna give the update today, but I think, just in light of like everything, and we actually have a member that's out, we'll just wait. So
All right.
We'll put it forward for some, for acceptance next week, or next
Sounds-
meeting.
Sounds good. And then I'm going back to the meeting minutes. Then talk about I just clicked on the wrong agenda, sorry. I'm like, that does not look like our agenda. It's the Heritage Preservation Society. 2022 work plan discussion.
Yep.
So I guess we're really just talking about possible work items. I feel like this might be kind of easy since at least two of the groups kind of wanted to go from research and report to more than research report, wanted to actually put that as an agenda item. So I know that Philip and I were talking about that with social connectedness. I know that the opioid subcommittee was talking about putting that on the work plan for next year
Right, there's some action.
as an action item. Okay. So that's two good items.
And I think that part of the action item for, I'm sorry, initiative 1 is to complete the report and make a report to city council. And also to, work on identifying other groups that we need to do some work to be socially inclusive of. Correct? Am I right about that, Julie?
Sure, yeah, we'll put it all in there. And I think I'd be very careful with that initiative, because I feel like it's to the point where, you know, the initial social connectedness issue is now kind of branching off into a lot of other things, and so I think
Yeah.
maybe it'd be a good time to kind of, you know, delineate between different items.
Yeah.
So we're putting it all in the report that should be done by next month, and we were trying to get it done by today, but it didn't quite work out.
What was that? What kind of report?
Oh, just the report to council. We're gonna try to have it done for today.
Got it.
Yeah, we had some issues with the template, and those are being resolved, and I just have to get to the business of writing in the text and everything. So I will do my best to be sure I get that ready for September, and then I'll bring that to you.
Right, so, what other, hey guys, so we're working on, we're to the point that we were talking about possible, work plan items for next year. We brought up, moving opioid issue to an action item, moving social connectedness to an action item. Do we have any other ideas?
Yes.
Great.
Ideas.
Perfect.
Okay, one idea, and this may have had some more bids, is have we done work related to what I call it would be an age-friendly Minnesota and what Edina would look like? And it,
There has been some stuff done on there that was about a year and a half ago, and it kind of fizzled out.
okay,
And Greg, please jump in, because I know you were here for that too.
Yeah. What was looked at was a formal program. There's some
Mhm.
nationally organized program that designates cities as being senior
The A-
friendly. That may not be exactly.
Yeah,
Incidentally, I apologize for being late, but I finally gave up on the web connection and drove in. For the fourth time entering my address, my phone number. It was ridiculous. Anyway, I digress. The problem was that there was an enormous long list of requirements that would have required a lot of resources.
Mhm.
And the feeling was that the effort and the administrative resources, the city resources that would be required couldn't be justified in Edina, where feeling is that on the whole, seniors do pretty well in Edina.
yeah, there was like it wasn't even just like walkability, I mean, there were different, it was a lot. Because Amanda looked into it, and like Hennepin County has like an entire little team working on it, and so it seems to be a lot more than what we thought.
was there any, in that analysis, was there an analysis of trying to break down to focus in on like a component of it? Or, you know, because I think looking at it as an entire package would be a lot.
And
That would be the,
I think that was the council's goal, was to get that accreditation, if you will.
oh,
And
okay.
all of this, so it wasn't even just like, okay, let's do this as an initiative, or this is like, here's a big body of work, we can work on these two things. It was, let's get this accreditation, we have to do all of these things.
Wow.
And that was more undertaking than we could handle.
If I recall correctly, Amanda Herr and some others worked on this and actually sent a report to the council, and the council basically said, well, that's too much.
Yeah.
So it would have to be much less formal and not nationally accredited kind of project.
Yeah. We are talking about the matter with the AARP, right?
Yeah,
Yeah, I thought so. Yeah. Yeah. I'm wondering if we should do some talking together in a group about what are some of the standards we want to see set. and maybe I'm throwing maybes here. You know, how we might want those standards to be set forth. I don't have any in my mind right now. I'm just throwing that as an idea. It could be an initiative about how do we want to improve the services for the aging in Edina. I mean, you could work that into an initiative one, or we could make that a separate initiative. I mean, there's always more to do about services to the aging. We do, you know, there is an ageism issue, period. And I mean, I think it would be a worthwhile thing if the commission wanted to put as one of our initiatives, perhaps for 2022, is to look at what the needs of the aging are within our community, and to look at ways that we might improve that. I don't know what you all think about that.
I think it's a completely, I mean, I think you can always link things together, but I think that would be a different initiative if you want to look into it.
Well, there's nothing that says that we couldn't make it a separate initiative. You know, the issue of aging was brought forward, so I'm just thinking maybe we're not going to we're not going to go for the AARP membership or whatever they call that. But we might look at some ways that Edina needs to work on its aging care. So I'm just saying that could be a new initiative that people might want to think about. But I'm putting that idea out there for anybody to do with it what they please. So, but there.
So the first rodeo, I'll just say, Greg, that was looking at really the whole thing, making it like which is a huge, you know, accreditation or whatever it's called, designation. So the question would be, if looking at that, if there are pieces of that would make sense, or gaps, or something that would be unique to our community, or that would be. Anyway, that is just that would be an idea. It also ties in with across people with different disabilities. So
Yes.
we'll be able to leverage those together.
Yes. Yeah.
And so, okay, so that's one idea. The other idea, these are just broad ideas, but I was wondering is that we had this concern about person's mental health. We also had an initiative to make Edina more like exercise, getting outside. And there's a connection between people's mental health and their ability to get exercise. And I'm wondering if that could be looked at together in terms of what we're doing to try to advance our mental health and tying that in with our other, you know, park kinds of things and that kind of thing. And then in a little bit more of a highlighted way, because there's some. And so that's an idea. I didn't do any research on any of these, so it's just
No,
like
I
just
love
like
brainstorming. No, I love it.
No, I'm glad the ideas are coming forward too.
But mental health is kind of a deal, and it isn't just like you
Yes.
going and taking your meds. It's like you get out in the community and you walk and you engage with people, and we have a lot of resources that are there. Well, is there a way to communicate with people about that, or how does that fit into what we're perhaps already doing? And you can just kind of highlight it in a little bit of a different way. So those are just my two ideas.
Yeah.
Makes me think the city has the resources for older people to do that, but I know from people in my age group that there's some reluctance sometimes, or just inertia to actually get out and do it. And I wonder if part of that would be to somehow create a mechanism for people to network so that 3 or 4 people would meet at a park to go for a walk 3 times a week, you know, go for a bike ride or trails. And
Yeah.
I'm not sure there's a specific networking mechanism for people who just want to get together and exercise with certain people.
Yeah. My next thought to add to all that goes kind of along with something that the opioid group has been doing. I happen to be one of those people who is agreeably obsessed with um, seeing to it that people in the community get information they need to know about things. And I feel that there's always a need for the community to get more information about various things, whether it be mental health, autism, people with disabilities or other things. I mean, that's one of those things about COVID-19 is part of that work is just getting out the information that the public needs. One of the things I'm wondering if this commission through a work initiative wants to do is, what kinds of information are being put out there? What might be some information that this commission needs to suggest to be put out there so that we continue not only as a commission to working on health issues, but also making sure that the right messages are getting out to the Edina community. That is something that I have particular interest in, and that's one of the reasons I'm doing my podcast, because there's so much misinformation about autistic people, for example. I want to see to it that people actually get information. And so, like I say, maybe we could look at what might there be some information that we might want our community to get that they're not getting now. Maybe we want to explore that and come up with a better idea, but that's just another thought I have. I'm just testing my sound anyway. Can people hear me?
Yes.
Okay, good. Went a little quiet there for a moment.
Hey, they're there, they're sitting there.
Okay.
I have another idea. I'm sorry, I'm just like an idea person today.
No, it's
On that
great.
same thing, is there anything about thinking about our website related to health that in the design of our website would be better, that we could do differently, would be a better way to get information out to our citizens? I mean, we know that the opioid thing was like buried, it was like unbelievable, and I just wonder, just as a focus area, given the fact that we're probably gonna be muddling through some kind of COVID mask thing for another year here, is there anything about our website that we should, that should have a focus in terms of health? I don't know.
Well, kind of the rules are fluid, right? I mean, everything keeps changing.
Yeah.
Does the city send out, I get some email blasts. I don't know what that's linked to though. Or if they, to your point, can they do something like that? And I don't know which ones I get.
There are two components. One is that the city website for health-related issues is fairly opaque. Mary and I really had to struggle to actually find what little was there. But the other is, even if it's a wonderful health-related website, people in the community need to know that that's a source that they can go to.
Right.
Right? Two separate problems.
Mhm.
And I would think that, a work group would have a real challenge in figuring out reasonable recommendations to the council as to what they could do, not only to improve the website, which needs to be done, but to get out to the community that there's a website they can find useful.
I wonder how much of that is also because of how closely we're linked with Bloomington. with public health and,
Yeah.
I don't know, I just,
May.
I'm not disagreeing with you.
Yeah.
I'm just
No,
saying,
no,
I
I
don't
hear-
know if that,
Right, Bloomington didn't distinguish itself either.
right,
So,
okay,
yeah,
well,
that would be a challenge.
Yeah.
project.
The best person who could answer some of that isn't here this month, so, but
well, there's
Otherwise-
great ideas, cause you know, we'll bring it up in September and we'll finalize it then, right?
that's right.
Idea time.
Yeah.
Mhm.
Yeah. If any of you are like me, when people ask you for ideas, you sit there going, what, and then later on you come up with something, you're like, oh, okay, yeah, hey, you know what? I do that all the time.
I think that, make sure that we come with more ideas, and maybe I'll ask Jeff to send out an email, because we do have to have it all drafted and finalized at the September meeting.
Okay.
So, I mean, we can draft it as we're going in the meeting, that's not hard, if he has the template, we'll just fill it in.
Okay.
Do we have any,
Something that occurred to me is that particularly because of the pandemic, bike riding has increased dramatically, probably doubled. And I wonder if there's anything to do to enhance bike safety in the city of Edina. I mean, we have trails, we have, but I know I see a lot of bike riders, with the total stuff, riders ignoring stop signs when there's traffic. that sort of thing.
yeah,
I don't know exactly what the city would do.
well, I know one time,
Yeah, I mean, like Minneapolis has Vision Zero, the county's got something.
Yeah, we
I mean,
had
the
a-
state has something, there's 3 parallel programs where like the goal is zero traffic related, like pedestrian or cyclist death.
right, and there was a big initiative a while ago about helmets,
Yep.
at least with youth.
I'm not sure what I mean, like obviously for Edina would be the county one, but I'm not sure if they had
Yeah,
how much conversation they had.
because no one's going to the gyms. I mean, really, people are finding alternatives to places to go. Okay? So how do we feel with those ideas? You can keep thinking about them too, we don't have to. Do you have more?
Right. Right.
You're looking at your phone,
No,
okay,
I don't.
I'm open for them, I'm waiting. I like them.
Well, yeah, let me just go back to I'll call it the mental health exercise one. I mean, older people, yes, but I would also say younger people too. Especially after our COVID, and a lot of times help me get a doctor in the house here in terms of when people are first diagnosed with illness. A lot of times it's when you're in what age? Well, who knows? Our system is a system of persons with mental illness. I mean, there is a teens and twenties challenging time. And so even the whole idea of engagement and exercise could really be something for that group.
Well, I think a lot of those, they're socially linked too, I mean,
Yeah,
kid, I think about a lot of youth are getting their exercise with sports, and that's also a social outlet. I mean, if you're not having that physical and social outlet, I can only speak for my children, knowing that it was rough,
it was rough
and it still is. No, sorry, you're not gonna play that sport, I think it's too high risk.
Yeah, yeah.
Mom, I'm like, no, I'm not vaccinated yet, sorry, bud. Yeah. Tracy, Philip, anything else? Sorry, I'm not trying to put you on the spot, but I guess I am.
No, I'm-
No, no, I can't think of anything else off the top of my head right now.
Okay, we can keep thinking on it too,
Mhm.
in the next meeting, sound good?
Yeah.
You're getting, you're good, okay. Subcommittee, are we good for me to move on?
Yes.
All right. Subcommittee report out, I think I kind of already touched on, the social connectedness initiative, we should have more of that. Philip's working on the Vitals app, I'm working on the other aspect. Smoke-free initiative, pause till next time. And we already talked for opiates, so I think we're good. We good?
I think so.
Awesome, all right. Any, member or chair comments on anything? Yeah, go.
Can I back up an idea just hit?
Oh, yeah, please.
That actually, I presented for a few minutes 2 years ago, and then with everything else got lost, but there's a national initiative called Stop the Bleed. That was triggered by the Stony Hook massacre. The chief of surgery at the major hospital in Hartford, Connecticut, reviewed all of the autopsies and other autopsies and realized that many lives could be saved, not necessarily in a mass shooting event in general. Many lives could be saved if people were more aware of the importance of direct pressure and if there were availability, just as there are for heart attacks with AEDs,
Mhm.
publicly availability of kits that contain gauze pads and tourniquets, stop the bleed, yes. And I had suggested that we look into that a couple of years ago, and then when the pandemic hit, other things seemed more important. But I wonder if we could look at Edina's preparedness for stop the bleed and consider such things as next to every AED to have a stop the bleed kit, which is made available by the Stop the Bleed Coalition.
Yeah, I would imagine that this kind of thing could also be, I don't know where they are with ARP money. But this is the type of thing that you could always you could use ARP money for.
Yeah.
Yeah. Add it on to the list.
Yes.
And maybe I'll email, probably easiest to email to Jeff when he's back, some basic information.
Yeah, when you said that, I sat here and I Googled it. I'm like, okay.
Yeah.
Yeah, no, it looks great.
One interesting, as long as we're talking about it, in Iraq and Afghanistan, when infantry soldiers were provided with training and tourniquet kits, the on-field mortality rate for serious wounds dropped from about 12% to 2%. This that keep somebody alive until they could get definitive care.
How is it not, is it part of basic first aid class? Is it? Okay, it's been a while since I've taken it.
Yeah.
Cause I mean, obviously it's not part of CPR, but I feel like a lot of times people do CPR and basic first aid together. I would think that would be part of it, or should be.
Yeah, but for some reason, that knowledge just never filtered through. That's the point of this.
Yeah.
Coalition. It's not only to increase the knowledge base amongst the general population, but to have, at least in public venues like high school gymnasiums and, supermarkets, places like that. And sadly, in the United States, there's no place that could
Yeah.
be thought of to have churches, movie theaters, schools.
And, you mentioned AEDs and, what about training for those also?
Well, that's part now of CPR training.
Yeah.
And the beauty of AEDs is even somebody who's never been trained, if they at least know that an AED is to be used in somebody who's pulseless, the AED actually gives verbal instructions.
Yeah.
Yeah.
It says, open the chest and put this here, put that there, push this button.
Yeah, there.
Yeah.
I can bring one. I have one.
No, I took the train about 15 years ago and I thought it was very helpful, you know.
Yeah,
But now you're right. A refresher course, I guess, maybe.
yeah.
So,
Usually they do, I mean, they say refresher every 2 years, but
yeah.
I know for like basic first aid, they usually don't teach how to use tourniquets, but like the
okay.
aspect of it. And also, with the AED in schools, having the stop with leak kit. And also in the health classes that are required, we go over like how to use an AED, what to do in different situations with first aid, like that's one of the units per se. And that could be really easily brought in. Yeah.
Great, yeah.
Right. Any other comments from anybody? We're silent. Okay.
Yeah.
Did Jeff have any staff comments he wanted to share?
He did not specifically, but things are developing with the masking mandate. So he said that there would be more information coming out about what the city's doing, planning, we're figuring things out.
Aren't we all?
Yeah.
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 Yeah, because I had sent something this past month. I don't remember who it got sent to, but I have an issue because I really can't. I find it very hard to breathe with a mask on, and that's one of the reasons why I chose to do this remotely. So I sent something to somebody about that concern.
That was me, Philip. I forwarded that on to MJ and Jeff, and
Yeah.
they've got that. They're working on that. There's some state mandate things they're trying to work around through.
Yeah, I would appreciate that. Like I say, I if the meeting's in person and they're requiring in person, that might be that would be complicated for me. But so I'm hoping you find a way to work on that. So thank you.
Would that include any of the variants continue to with us?
I was not even. I didn't really hear that comment. There's been some disruption in the sound here. So
Yeah, and I don't know if we're allowed to close the doors because we're not the HRC. Would you guys open to close the door?
I think they're leaving. There's just some trash bins going around. Like, what were you saying, Mary?
I was gonna just say, my question was whether meeting face to face is gonna be advisable,
I don't think so.
given the, right, given
I'm
the.
sorry. Do that.
I mean, I don't know, I mean, you've got these requirements, however. Oh,
I mean, literally, this is the only place I've gone that I haven't just opened my trunk and people put groceries in the back.
yeah,
So,
anyway.
but I don't know.
yeah.
Wasn't there a 60-day limit beyond
Yeah.
which
Yes, and the thing,
meetings could be conducted? Did that have to be changed?
so the 60-day limit is up. This is the last meeting. And the issue is that it's by the governor's emergency orders, which he gave up all power of that to pass the budget in July. So I don't see that coming back.
Yeah.
Do you have any comments? I'm like, I don't know.
Well,
I don't think the political will is there to attempt it. It's not gonna
I
happen.
know. I am worried if something isn't figured out for next month. Like I say, I don't know what I will do, but you know, there is a sensory issue for the masks for me as well. It's something that it just makes me go kind of. It makes me very uncomfortable and makes me very. It's more than uncomfortable. I just feel like I can't really think or talk or function quite the way I'd like to. So I'm hoping a solution can be found. I really do. And I don't know what I will do if the answer is we still have to meet in person and a mask is required. I'm not sure what I'm going to do in that instance, to be honest.
It's a state laws, I understand it, that these meetings need to be
Yeah.
in person, but is there any kind of local override option within the law? In other words, can the city council say Edina meetings can be held virtually?
Some of it depends on the way the cities are set up. Like Minneapolis, like we have like the commissions aren't going back for a couple months still. But I can't remember what the stipulation is there. I think it's just, it's how much, like leeway some cities have, I think, to set some of their own
Yeah, I'm not
regulations like that. But I mean, it should be easy enough to figure that out, because I mean, we're not the only group sitting here asking the question, I'm sure, so.
No.
Let me see if I can
Yeah.
figure out. I'll talk to like like some people tomorrow, just in like work capacity, and see if they, just to try to figure out what the difference is, like why we can do it in Minneapolis, but we can't do it.
And the city attorney would looking into that whole issue.
Yeah.
I think it looks pretty bad if the health commission gets together and then.
Is that, everybody else?
Just say, I'm just gonna put it out there, I feel like that's just
Makes
kind
no
of my luck.
sense. It just makes no sense. I'm just like.
Yeah, so like the city attorney or the city clerk would probably be the people that would have. the information.
Yeah, or at least, you know, is this the only room that has the capability of the recording?
It is, the mayor's conference room doesn't even have a monitor TV,
It's-
council chambers, but yeah, these.
I mean, I feel like that's the next step is saying, okay, great, but we're moving to council chambers because that's the only place that we can spread out enough. Just my opinion.
Once you get spread out that much, it becomes almost less interactive than a Zoom meeting or a WebEx.
Yeah, I'm not disagreeing. Okay. Any other things from Jeff?
Nope, that was it.
Okay. Does anybody wanna call to adjourn the meeting?
Yeah, motion to adjourn.
Sure.
All right, anybody opposed? Nope, everybody approve? Aye.
Hey.
All right.
Thanks, everybody.
Like that.
All right, everybody. See you next month.
It's awesome. It's like.
Friend, comment.
Yeah, two sick kids.
Always